Amid this litany of corruption and chaos, the one point I have to underline is Robert Kennedy puts children in harm's way every single day in America. To my Republican colleagues, I must ask, what line must Robert Kennedy cross before some of you will also join this alarm? During his confirmation process, he claimed to be pro-safety and pro-science, but his actions reveal a steadfast commitment to elevating junk science and fringe conspiracies. His agenda has not been about choices and information for families. I hope that you will tell the American people how many preventable child deaths are an acceptable sacrifice for enacting an agenda that I think is fundamentally cruel and defies common sense.
Secondly, an email from a physician friend of mine. Hey, Bill, I'm not even sure what I'm asking you, but we're all confused and concerned about who can get the COVID vaccine. We are having our attorney try and render an opinion, but there's no firm guidance and concern about liability if vaccines are given to a patient who requests it, but not on the current CDC list. Pharmacists are requiring a prescription now even for patients over 65, creating a huge headache. I submit these for the record.
Without objection.
I would say effectively we're denying people vaccine.
This is the last thing, by the way, our parents need when their kids are going back to school, is to have the kind of confusion and expense and scarcity that you're creating as a result of your ideology.
The mRNA technology is about continuing the research to be ready for the next flu, influenza, the next pandemic, and you have to do the research.
I'm happy to have a detailed discussion with you about it. You're so wrong on your facts.
You're interrupting me, and sir, you're a charlatan. That's what you are. You're the ones who conflate chronic disease with the need for vaccines. If you want the Northwest to just to continue to lead on all innovation and all healthy people, okay, we'll do that. But it's a sad statement for the rest of America and America's leadership on technology.
How much are Medicare Part B premiums expected to increase next year?
I don't know. I talked to Dr. Oz
that is about, my concern is you can't answer the questions. The very agency has oversight over these issues and controls the levers to lower costs for seniors. And you can't answer that simple question.
How can you be that ignorant? You're supposed to be doing health care policy, not being the doctor in residence for all of America.
The process for COVID vaccine approval was public, it was live streamed, and it was out in the open. And the evidence is clear and supports what President Trump has said. The vaccine works, and it has saved millions of lives. Your own process, on the other hand, has not been transparent. You repeatedly choose to ignore data because it doesn't match your preconceived notions and lies.
The industry makes the studies, and they could not provide a study that said that it is effective for healthy kids.
So when have you produced the data that you relied on and that this FDA relied on to change those parameters? You did it behind closed doors.
No, the data is all public.
Now parents who decide that they do want their children to have
You're just making stuff up, Senator.
I'm not
You're
making
just
stuff
making stuff up.
You know, sometimes when you make an accusation, it's kind of a confession, Mr. Kennedy.
As Senator Dr. Cassidy said, you are effectively denying people vaccines.
We're not going to recommend a product for which there's no clinical data for that indication. Is that what I should be doing?
What you should be doing is honoring your promise that you made when you were looking to get confirmed in this job.
And by the way, a month ago, you were voting against her.
I voted against her because I was afraid she was going to bend the knee to you and Donald Trump. And it looks like she didn't bend the knee, so you fired her. Look, you're putting America's babies' health at risk, America's seniors' health at risk, all Americans' health at risk, and you should resign.
There's a big difference, Senator, between established science and the scientific establishment, which has been co-opted by the pharmaceutical industry.
So you're telling the American people that the American Medical Association, representing hundreds of thousands of people, have been co-opted and that they should not trust their doctors.
And
the American Academy of Pediatrics, and by the way, you received $300,000 from people, not from the industry, people in it, as I did, from individuals. You corrupt. President Trump got $3 million. Every Republican got corporate PAC money for the pharmaceutical industry. Democrats as well. Everybody is corrupt, but you? Is that what we're looking at? I don't think so.
You have led the charge in the Trump administration to destroy what is best
in our healthcare system. And your denials and your evasion and your lies here do not change that. And you seem to be willing to say anything in the moment.
Despite your lack of credentials and expertise, clearly you have an agenda. It is a threat to the public health of the American people. It's clear that you are carrying out your extremist beliefs, which is why you attempted to fire Dr. Monarez.
We're the sickest people in the world. We're the sickest people on earth.
I'm speaking.
How am I a threat?
Secretary Kennedy, for the first time, we're seeing deaths from children from measles. We haven't seen that in 2 decades. We're seeing that under your watch. You are a hazard to the health of the American people.